Welcome, everyone. My name is Martine Chaussard. I'm the Deputy Director of Policy, Advocacy, and Communication for Reset Alcohol at Vital Strategies. Thank you for joining us on a Monday. I know it's morning for some of you, late at night for others, but to discuss health taxes and alcohol taxation in particular. There's quite a number of you online. Some of you are partners that we work with closely on the topic, and that's great to see you, but also new names. So it's encouraging to see new people taking interest in this topic. Welcome to all of you. Today we are launching the Principles of Alcohol Taxation, a new policy note from Reset, and we'll have Dr. Jeffrey Drope from the Hopkins Bloomberg School of Public Health Economics for Health team presenting the highlights of this policy note. We'll also have a conversation with three guests, very esteemed colleagues, really, who are active contributors to this policy field and come from different sectors. First, we'll have Itziar Belaustegui-Goitia. She's a technical officer at the Pan American Health Organization, or PAHO. We'll have also Empo Lehote, Director of VAT, Excise, and Subnational Taxes in the Tax Policy Unit of the National Treasury of South Africa, and AJ Montesa, a consultant for Action for Economic Reform, or AER, in the Philippines. And then after this discussion, as we normally do with these webinars, there will be time for questions and answers at the end. Feel free to leave your questions as we go along in the Q&A box, please, not in the chat. So in the Q&A box, and we'll compile them for the end. We'll have about 10 minutes, maybe a little bit more depending on how things go for questions. But before we start, I'd very much like to introduce Jackie Drope. She's the Managing Director of the Reset Alcohol Initiative here at Vital Strategies, and she'll get us started with a few words about why the launch of this policy note is so momentous for us. So Jackie, on to you.
Great. Thanks, Martine, and good morning, everyone, and thank you for joining us today. For those of you who haven't heard of Reset Alcohol, this work began 3 years ago with the support of Open Philanthropy, with the goal of supporting national level efforts to increase alcohol taxation in order to reduce consumption and alcohol harms. I think if we're honest, we can say that until now, as societies, we've really buried our heads in the sand about the vast arrays of harms caused by alcohol, including cancer, heart and liver disease, mental health issues, interpersonal and community violence, road crashes, and that's just to name a few, unfortunately. But there's definitely a shift happening that recognizes the need to address these harms. For decades now, we've known that tobacco taxation is one of the most effective ways to reduce tobacco use, and we now know the same for alcohol. Unfortunately, this amazing public health tool is vastly underused. I'm optimistic, though, that this is changing as I watch the Reset country partners like Brazil, Mexico, Colombia, South Africa, and Philippines do really innovative research, advocacy, and comms work around alcohol taxes. These countries are going to serve as models to the world. Reset partners, we spend a great deal of our time figuring out how to communicate the fact that there's actually such a thing as good tax. We also grapple with the fact that there are technical differences across unhealthy products. So while countries can package these taxes together, they do have to think about the technical nuances. This is why the Principles for Alcohol Taxation policy discussed today was born. We needed technical experts working on this area to provide clear, concise guidance on alcohol taxation for governments who were requesting it. With this in mind, our Reset Alcohol Technical Lead Organization, Economics for Health at Johns Hopkins, brought together global experts from across the world to figure this out together this past May. After months of productive peer exchange, I'm thankful to the many, many people who have given their time and expertise to ensure this practical and user-friendly guidance is out in the world. Today, I look forward to hearing from our distinguished panel about what these principles are, how they're being used in real scenarios, and how we're going to have all of you use these to champion alcohol taxes in your countries. Thank you and enjoy.
Thank you so much, Jackie. And as you mentioned, there is definitely a shift and reckoning to address alcohol harms that's happening. And there's also an understanding that there is such a thing as good design when it comes to health taxes and alcohol taxes in particular. Taxes that actually save lives, not only raise revenue or raise prices, but actually save lives. And that's what we're here to talk about. And so I'll turn it over to Jeff now, who's going to walk us through the highlights of this policy note.
Thanks so much, Martine and Jackie. And it's a great intro. And I think I'm going to be able to go quickly through some of my slides because you've covered so much ground here. So next slide, please, Tia. As Jackie said, why now? This is really a demand-driven document. We have been working in a lot of countries, and we've been getting a lot of really direct requests for technical assistance, and really specifically about what are the best practices. And because we work globally and we can see things across a lot of countries, it's given us a lot of insight, I think, into what those best practices are. And I'm extremely grateful to all the colleagues that Jackie mentioned that were part of the process last May and subsequently in the months following that had this really vibrant and really lively conversation about how to best tax alcohol. This is really meant for all stakeholders, governments, but everybody else too, because we really need to think about how to do this best. And because alcohol taxation, quite frankly, is behind other unhealthy product taxation, such as tobacco and sugar-sweetened beverages, we have a little catching up to do, but I think we are getting there and getting there very quickly. Next slide, please. Just to brief, for those of you not big tax people here, it's a really simple mechanism, and it's partly why we love it so much. When you raise taxes, companies have to raise prices because they need to make a profit. It's particularly true for publicly traded companies because they actually have a fiduciary responsibility to do this. And in fact, most of the alcohol companies in the world are publicly traded. So this works particularly well in the market structure of the world. When those prices go up, consumption goes down, and then we reap all of those benefits in terms of addressing both the economic and social and health issues that Jackie highlighted. Next slide. How are we doing? Jackie hinted at this, not well. We really could be doing better. We're doing better than we did, I think, 10, 15 years ago. But we know that excise tax rates in general are quite low. We know that prices as a result are low, and products are affordable in most countries, or at least there are affordable products in most countries. Those are two different things. We know that tax share of price is low. When we compare it, for example, to tobacco, you can see that beer is about a third. So that's really quite striking in terms of how low tax rates are for excise taxes. And we also know that tax structures are often flawed. We see really just structures that don't work well and don't drive prices upward and frankly leave a lot of low price products in the marketplace. I'm not going to dwell on this because I'm going to get into them in the principles. Next slide. Just again, very briefly, Jackie talked about some of the social and health costs, but the economic costs are staggering. Manthe and colleagues did a very nice paper a couple of years ago that really estimated that it's at least 2.6% of GDP in many countries. A little more than a third of that is direct costs, mainly healthcare costs, and the remainder is lost economic productivity, mainly in terms of the indirect costs, because really, frankly, alcohol use strikes younger people in a very big way. So we have major problems in terms of presenteeism, absenteeism, just lower economic productivity. And then a lot of people, frankly, get sick or die during working age. And so this has huge implications for our economies. Next slide, please. I'm going to go over the overarching principles, which are a little different than the specific principles that I'll get to in a moment. Next slide. First thing is, be very clear, we want to use alcohol excise taxes to improve population health. So we know we're going to reap revenue because of the inelastic nature of alcohol products. But to be very clear, we know that this is a tool for public health and population health outcomes. Next slide. We believe and have seen very, very clearly in real life that governments have to strive to have clear and simple definitions of what an alcoholic beverage or an alcoholic product are for the purposes of taxation and regulated regulation. So this is very important. Next slide. And we do believe that alcohol taxation is best implemented with a comprehensive set of proven alcohol control interventions. And I'm going to give a shout out to our WHO colleagues who have the SAFER initiative. There are all sorts of really fantastic companion policies that go with alcohol taxation, marketing restrictions, drink driving policies, support to help people deal with their alcohol use problems. So there are these companion policies, and we see that when they are packaged together, it all works better. Next slide. Now let's go over the principles very quickly so we can get to our discussion. I'm going to go quickly through several of them simply because they get a little bit more technical, and I encourage you, A, to go to the document itself, but then B, to reach out to us. Really, we worked with such a fantastic group of experts when we were putting this document together. All of them are highly qualified to respond to your concerns and your questions. So we really have a fantastic alcohol taxation community that is building and only getting stronger by the day. So I really encourage you. There are a lot of organizations working on this. I would certainly point to the World Health Organization's Alcohol Tax Manual, which is an excellent resource and a very good discussion. Less prescriptive, perhaps, than we're being here today, but nevertheless a really valuable document. Likewise, the IMF has a very nice document on taxing alcohol. Again, less prescriptive, but also very, very helpful. Next slide, please. Principle 1, because consumption of alcohol, that is the ethanol that is in these alcohol products, is the direct cause of health and social harms, its measures should underpin the tax structure. So let's go to the next slide. I'll just expand on this slightly. Tax structure starting point should be a specific tax based on the amount of alcohol. We have seen this across countries and across time. This tax is the harmful ingredient within these products. And so what it does is it drives the price of all products upward, but it especially drives the price of the lowest price products upward. And in fact, it shrinks prices together upward. And that means that it is less easy and less likely that people will substitute down to a product that is less expensive. So it really is a very good starting point. This isn't to say there aren't other structures that work, but we have found that the structures that typically rely on this specific excise tax based on alcohol typically work the best. Ad valorem taxes are trickier because, of course, when you have a low price, the ad valorem tax, because it's based on the value as opposed to the unit, you're going to find that those taxes are actually quite low. But when you use a specific tax, which is based on the unit, let's say a liter of alcohol, you can really drive those prices upward. Typically, we find our colleagues in tax authorities tell us that the specific taxes are easier to administer, and it's less likely that producers and other stakeholders in the supply chain can cheat as they can with ad valorem taxes. Next slide. Principle 2, tax authorities should strive for consistency in how alcohol taxes are applied. And let me be clear, what we see, unfortunately, across the world is that different products are treated differently, especially, for example, wine in the European region tends to get treated much more favorably, like not having any taxes at all. The ethanol in wine is no different than the ethanol in other products, spirits or beer. We also hear from some countries that beer is less harmful. It's the same ethanol, and you can consume just as much alcohol by drinking beer and face those harms as well. Many marketplaces we have seen are primarily beer, which would suggest that you shouldn't tax any of your alcohol marketplace, which is, of course, ridiculous. So what we should really be looking at is making sure that the tax per drink is fairly equal, if not equal, across all products. This isn't to say that there are some products that can't be taxed specially. What we see is some products will have disproportionately more harm. Maybe they are aimed at young people to get them to start. Maybe they're aimed at heavy drinkers. to get them to drink more. And in those cases, there are some exceptions to, perhaps taxing some of those things more aggressively from a high baseline, I might add. But it is really important that we really drive the price per drink upward for all drinks. Next slide. The third one is government should implement substantial and regular increases in alcohol excise taxes. We've got to push these prices up. And again, we are seeing this across the world. These prices simply are not going up quickly enough, or in fact, not at all in a lot of cases. And what happens is if you don't push those taxes up, those prices don't go up, and then the effects erode. And in fact, those products become more affordable and people consume more. So got to have a system that pushes those prices up. Next slide. When we use an ad valorem tax, it should be applied as close as possible to the retail price. So this is really important. It's not always easy to do politically and for other reasons. But what we see is that when countries are using ad valorem taxes, again, we don't counsel to use ad valorem taxes too heavily. They can be done in conjunction with a specific tax, but the specific tax should make up most of the tax burden. And so when we use these ad valorem taxes, we just have to make sure we're taxing on as high a price as possible. When we see governments using producer prices, that's where we see really, frankly, a lot of the cheating, because producer prices are very difficult to pin down, and quite frankly, producers lie. And this is a really difficult task for tax authorities. Next slide. Closely related, unfortunately, we do have some countries using ad valorem only taxes. As I said, it is certainly not our preference, and we typically find it does not work well. In this case, we would recommend including a minimum tax in absolute value. There are lots of different ways to do this. I won't get into the subtleties here. And that minimum tax should be updated for inflation and real income growth. So we really got to be staying ahead at all times of the combination of inflation and real income growth, because that is how we affect affordability and make these tobacco products less affordable for consumers. Next slide. Last one is for low and no alcohol products. We believe that the same structural recommendations generally apply, so you should treat them the same in terms of how we treat alcohol volume. This is to say that this is not the harm that comes from these products tends to be indirect. It's not necessarily from the ethanol so much. It's ways, for example, using no or low alcohol products to market higher alcohol products or to market to children. These are obviously nefarious things that companies do in order to gain consumers. So we do have to be aware of that, but we also have to recognize there are other policies that we can use to deal with this. Tax is not a panacea. It can be used in conjunction with other things, but we have to be a little bit careful about how we use tax going forward. Next slide. Just a word about unrecorded alcohol, which includes illicit alcohol. This is a really complex issue, and we find that it is quite country specific. The types of unrecorded alcohol products really varies across countries, so you really have to understand what that marketplace looks like. To date, there is little evidence of substantial substitution from the legal products to the illegal products or unrecorded products when taxes increase. There will be some substitution in some cases, but we really don't see it undermining the tax increases that we have seen put in place on alcohol. And there are measures that governments can apply to greatly mitigate these challenges. Again, I won't get in the 2 minutes I have here, but rest assured, there is a growing body of literature, and governments are really finding effective ways to deal with this issue. Next slide. And next slide. I'll just go straight to the conclusions. Folks, alcohol taxes work. They drive down consumption. They drive down prevalence. We know from several decades of experience at the country level and a lot of and growing body of related research that demonstrate what our best practices are, and they're reflected here in the principles that I just outlined. We do reserve the right to update this. We are learning, folks. We are definitely still in a learning stage. There's no perfection here yet. We are delighted to get feedback from all of you on. I know there are many experts I can see online here, and please reach out to us. This is an ongoing discussion that we want everyone to be part of. And as researchers, we still have some work to do, folks. There are some gaps in the evidence base. we're filling those gaps, but we have work to do to support our colleagues in government and other stakeholders that are pushing for tax reform. So I'm going to stop here, and I'm really delighted to have an amazing set of panelists with me here today. And we've invited them because they all kind of come from different facets of the world in which we inhabit as we're trying to promote alcohol taxation. First, I'm gonna ask Itziar to say a few words. She comes to us from the Pan American Health Organization, an intergovernmental organization. They provide a lot of support to governments around the Latin American region, Caribbean region, do amazing work on health taxes, and have a unique perspective, I believe. So, Itziar, I'm going to hand over to you for your reflections.
Thank you, Jeff. Well, first of all, good morning, afternoon, and evening. I know we're spread across all hours, so good morning, afternoon, and evening. And thank you so much, Jeff, Jackie, Economics for Health, and Reset for having us. As Jeff mentioned, I'm here on behalf of the Pan American Health Organization, and we focus, I'm part of a very particular team on economics of NCDs, and we focus on helping member states implement cost-effective policies to address NCDs. We have a strong portfolio on health taxes, which includes alcohol tax, tobacco tax, and sugar-sweetened beverage taxes. From a regional perspective, we see the reflections that Jeff mentioned at a global level. We see that countries are largely underutilizing alcohol taxes, in particular when we start comparing to tobacco taxes, which has a more active, I would say, community behind it. We're just starting to take up, I think, alcohol taxes at a similar level as we have as tobacco taxes. But I'd like to share a little bit more about the regional perspective. There are several instruments that we use as part of PAHO WHO in order to track consumption and some different sets of policies. In the latest alcohol report, we see that the region of the Americas, in the second column you see, is the second region with the highest level of alcohol consumption per capita when measured in terms of liters of pure alcohol. So in the Americas, we have high levels of alcohol consumption, which is concerning. Jeff cited some figures in terms of cost to society as a percentage of GDP. And what's particularly concerning, it's not just the high levels of alcohol consumption, it's also the trends. It's also the patterns in which alcohol is consumed. And also from the latest report, we have a figure on heavy episodic drinking per region. And we see that the line in red, that's the Americas, it's the second highest as well. So in the Americas, we not only have high levels of consumption, but also particularly risky drinking patterns. Next slide, please. Also, both Jeff and Jackie mentioned that alcohol taxes are best implemented as a comprehensive package of interventions. So I just wanted to draw attention to some commitments, technical packages that we have, not only in PAHO, but all WHO regions have these. We have the Global Plan of Action to prevent and control NCDs. This has an alcohol reduction target. We also have the Global Action Plan, the Global Alcohol Action Plan, and a global strategy. We were part of a webinar a couple weeks ago on alcohol taxation in Brazil in light of the ongoing reform, and one of the Receita colleagues mentioned that WHO loves acronyms, and I think we do. And SAFER is essentially an acronym for the good and best practices, the good and best buys that we have identified as part of the available interventions for the Global Plan of Action. It's an acronym for these interventions that are proven cost effective. Jeff already briefly mentioned them. It's strengthening restrictions on availability, enforcing drink driving, etc. And the last one of these is raising prices through taxes. Next one, please. Now I'm going to come back to the region. I have been part of PAHO essentially since 2015. And in 2015, we realized that tobacco taxes were quite a bit ahead in terms of available standardized evidence, comparable indicators, etc. So in 2016, we started creating an indicator comparable to one that had been created for tobacco taxes in 2008, which is the tax share indicator. It's a very simple indicator, essentially, what percentage of a price do taxes represent? So in PAHO, we started collecting this information in 2016. We have our first estimates for countries for 2018. And in 2022, the same methodology was scaled up at a global level. So WHO started collecting this information every 2 years. So we have global information for 2022, and this is what you see in the screen right here. So on the left side, we have regional estimates for the price of beer, and it's disaggregated by taxes as well. So total taxes in the Americas, and the price is the second lowest of all regions. And we see the same trend for spirits. We have very low prices compared to the rest of the regions, and our tax levels are also very low. So this is particularly concerning when we look at it in light of the previous slides that I showed you, where we see that in the Americas we have really high levels of consumption, really harmful levels of consumption, and really low taxes, really low prices. And this is where the importance of creating tools that are going to help us move forward in terms of implementing the cost-effective strategies that we have, such as taxes. We see here very clearly that we are underutilizing in the Americas a very effective tool. And as I mentioned before, we have been tracking this since 2018. Unfortunately, we haven't seen much progress in the Americas. We see still that countries are not utilizing this tool as a health policy tool. We know that most countries do implement taxes on alcohol, but there's been a history of doing so from a revenue generation perspective. We need to really harp in the importance of utilizing these existing tools and making sure that they reap other benefits for society. And we have also, Jeff mentioned, our WHO manual on alcohol taxes. This is really an encyclopedia of everything you might want to know of the evidence up to date on alcohol taxes. Really, it's such a robust resource with information not only on country experiences, also on industry tactics to delay or weaken the implementation of these taxes. So why am I bringing this up? Because we have been working at different levels on alcohol taxes, but no single resource, just as one, no single policy is going to be the panacea, right? So we need resources that speak to different audiences. And I think this resource helps us distill some of the key messages in our alcohol taxation manual, that's an encyclopedia, and it will help us translate those very technical messages to a different audience. We need civil society to move forward on alcohol taxation, and I think this is going to be a great resource to really translate those technical concepts into more friendly terms, because sometimes we get quite caught up as technicians on alcohol terms, structures, etc. So I'm really looking forward to how this resource will help us mobilize action in the Americas. Thank you.
So much. It's your really interesting context in the Americas, and some great progress being made, and obviously a lot of work to be done still. So we're grateful for all of the work that PAHO and your colleagues do. I'm now going to go to our government representative here, Empho Lokote. Empho, you represent a government that really does a lot on alcohol taxes, and very impressive the way that you folks engage on this issue. And I would really love to hear from your perspective as someone working in a revenue authority that thinks a lot about this. What do you think?
Thanks, Jeff, and thanks for inviting me to this webinar. I think from the National Treasury's perspective, we think of an excise instrument as a very important instrument in terms of contributing towards sort of the reductions of alcohol harms, and we use that instrument effectively. But I think, I mean, as everybody has said, I think there's still more room in terms of utilizing it. But as a policy, we increase excise duties by inflation as a minimum, you know. But over the years, we have been increasing our excise taxes by more than inflation to also sort of contribute towards the revenue objectives of government, not only just deal with harm reduction. And in terms of the principles that we have outlined, our beer category and spirit category is we are taxing it based on alcohol content, which is quite important to be able to apply that. And also with regards to wine, as we have indicated, many countries, especially when you look at Europe, is taxed favorably compared to spirit and wine. We also in South Africa have a similar situation where wine is taxed less than beer and spirit. But we are currently engaged in a reform process where we want to reform how wine is taxed, because currently wine is taxed on per liter basis. So we are thinking of a reform process where we can take account of the alcohol content of wine and tax it differently, or tax the different bands differently based on the alcohol content, even though it might still be taxed on per liter basis, but it will have sort of like bands to just in recognition of the alcohol content and the harm related to the high alcohol content in some of the wine. And I think one of the important issues around sort of the use of a specific excise, as you had indicated in your presentation, Jeff, is that with specific excise, therefore you don't deal with the issues around manipulation, especially if you're using ad valorem, where pricing can be manipulated. There's undervaluation that comes into play if you are using an ad valorem, because it looks at the value of the product. So we favor specific excise, and then we increase it by inflation as a minimum, but historically we've been increasing by more than inflation. And I think that's the way to go. And also looking at complementary measures. We think complementary measures are quite important. As it's already been indicated that an excise tax is not a silver bullet, or is not a panacea to deal with everything, but it is an important tool in terms of reducing consumption at the population level. So I think maybe, Jeff, I think from my side, just as a initial intervention, just to say that the principles that we have outlined, in as far as possible, we have implemented that, and we support the use of specific excise based on alcohol content, and we are engaged in some reforms to look at those products that, especially wine, on how we can incorporate some of those principles in terms of how we tax wine going forward. Thank you very much.
Thanks, Empho. And it's so amazing to hear, well, first, just how thoughtfully your government is working on this. Obviously, wine is an issue, and you're trying to find a creative solution. I will, warn some listeners here that South Africa is a very high capacity country in terms of you have a really quite extraordinary tax authority that is well tuned to these issues. So you're going for a solution that I think will work to tax the harm of wine, but is maybe a little unorthodox in terms of being simple. But nevertheless, I applaud the efforts, because you obviously recognize the challenge here. Last but not least, I'm going to ask AJ Montesa from AER in Manila to talk a little bit about the civil society side of this. Over to you, AJ.
Thank you, Jeff. Good day, everyone. I'm very honored to be here to represent civil society advocates in the Philippines who have been working for stronger, fair, and more effective health taxes. Our experience in the Philippines with health taxes is that while significant gains have been made in the way of tobacco taxation, there is still a lot more to be done for alcohol taxes, both in terms of policy and for building advocacy-oriented coalitions. So for advocates, these principles on alcohol taxation reflect two fundamental truths. First, that alcohol is harmful, and second, that taxes are among the most effective policies to reduce those harms. So these principles that you've outlined make it very clear that taxation is not just a fiscal tool, but a life-saving and health-affirming policy. So for us in civil society, the principles are more than just technical recommendations. In the work that we do, I would consider these principles as a sort of roadmap. They lead us towards a direction for better, if not the best, alcohol taxes. By describing what better looks like, they make it much easier to explain to the public, to policymakers, and to other stakeholders why alcohol tax reforms are both urgent and actionable. In the Philippines, our experience with tobacco and alcohol taxes actually gives us a useful lens for appreciating these principles even more. So, for example, in our fight against tobacco, we realize that among the industry's tactics are confusion and misinformation. So the industry tries to muddle the conversation by exploiting complexity and by exaggerating the administrative challenges brought about by differential products and prices. And it became apparent that in our work on alcohol, that the same tactics are used by the alcohol industry. But unlike cigarettes, alcohol products can vary quite substantially by size, by content, by category. And this variation actually creates opportunities for manipulation by the alcohol industry. So I think the beauty of these principles is that they allow us to cut through the noise and to bring us back to basics. The principles provide a clear and simple message that we must focus on the substance that causes harm, that is the ethanol, and that the taxes should rise regularly, consistently, and substantially so that alcohol becomes less affordable in real terms. So I don't think that any country currently meets the principles 100%, and I think that's okay for now. But perhaps these are not so much meant to be rigid rules as they are to be directional guides, which were born out of the evidence and real-world experience. What matters to us is that we use these principles to push policies in the right direction, even as we navigate our respective countries' complex political and institutional landscapes. So for advocates, I think these principles are quite empowering. The simplicity of the language allows us to connect taxation to health and to fairness. And the clarity of the principles allows us to check whether tax reforms in our respective countries are aligned with best practices. So the bottom line is that we can hold our governments accountable, especially our finance ministers and lawmakers. Furthermore, the rigor and expertise that enable these principles to be shaped builds bridges between policymakers and economists, health professionals, and advocates so that we speak with a shared vocabulary for reform. I can personally assure this, I was in the room when the principles were first drafted. So this is what civil society can leverage the most. Evidence-based and actionable guidance that we can translate into public campaigns, coalition messages, and concrete legislative proposals. The principles help us to elevate the conversation from the basic of why we should tax alcohol to the more advanced, how can we tax alcohol well or better? So to Jeff and to the team from Economics for Health and to Reset Alcohol, of course, and to all the experts and organizations who contributed to the careful crafting of these principles, we thank you. You have given us not just a document, but a tool for mobilization. So our task now as civil society is to organize and to mobilize so that these principles aren't just relegated to technical documents and webinars, but that they find their ways into the pronouncements and policies of those who hold power to save lives. Thank you very much.
Over to you, Martine. Thank you, AJ. That was fantastic.
Yeah, thank you. Thank you to all our guests and for this great discussion. It was really lively, so we went a little bit over time, but the good news is we'll be able to stay a little bit longer for another an extra 5 minutes, so probably until 10:50 Eastern time. Speaking, as a segue to what you just said, AJ, I'm sure people will want to see the document, so I'm going to put it in the chat. It is now up on our website as of today, so you can consult it at your leisure. I know that we also have some good questions. Jeff, you've already answered, I think, some of them, but we have a few that are open. So I'm going to so I'm going to start with one that I think will be for you, Jeff, and it's probably quite a good place to start, but are higher taxation effects similar from tobacco to alcohol? And I assume that means in terms of impact from price to reduction in consumption.
It's a great question. It's Econ 101 in terms of elasticities. And so, yes, I would say that the literature shows that the consumer reaction, if you will, is very similar. So about a 10% increase in price will lead to somewhere between maybe 4 and 8% decrease in consumption. It can be wider in some places. We do actually see more variation with alcohol versus tobacco, but they're remarkably similar. And in most cases, not always, but most cases inelastic, which means that when you raise the tax and the price goes up, that the consumption goes down, but the tax revenues go up in almost every case. We have some exceptions to that where we see consumers are more price sensitive for a variety of reasons, but I would say it's actually quite similar. So in that way, it's different than, for example, sugar sweetened beverages, which have different elasticities.
Thank you, Jeff. Another question that I think is interesting, because we hear it often, it's often an argument that's presented kind of against alcohol or health taxes in general. Are there concerns over the equity implications of such taxes, that they would harm low-income consumers more than high-income consumers and then not curb behavior?
I'm happy to start on this one, and then my colleagues can chime in. I will say the research we're asked in the Q&A, is there more research? We do need more research on the equity implications. What I can tell you is that alcohol use disproportionately harms those in lower socioeconomic groups. So even if the actual alcohol taxation isn't, obviously progressive like it is with tobacco, it is going to, in the end, indirectly be very progressive, because those in lower socioeconomic groups are going to decrease their consumption, and they're going to reap those benefits. And because they are more likely to use alcohol, and more likely, frankly, to use alcohol more harmfully, and then to not be able to deal with the consequences of it, in terms of labor issues, healthcare. I would say that in the universal scheme, it is very progressive, and we would absolutely encourage it as a way to increase health equity. But Itzia, I'm sure, has something good to say.
Just a small piece to complement. I think it's also important to consider that alcohol displaces spending in other essential goods and services, food, nutrition, schooling, healthcare, etc. So there's an equity component there as well to consider, in addition to what Jeff mentioned.
Thank you, Itzia. That's a really good compliment. There is another question. There were a couple questions on this topic. How do governments create enabling governance to route revenue from excise taxes toward line function departments that claim a lack of financial resources? For example, for the prevention and control of NCDs, creating public campaigns and messaging. And I know there was also a specific interest around that for South Africa and the South African region, Southern African region in general. But I know this is also a question that normally has passionate answers.
I think Limpo should start.
Yeah, no, I think I should start on that. I mean, the issues of the alcohol or the revenue from alcohol excise, I think is important in a sense that yes, we raise revenue from alcohol taxes, but from the Department of Finance or from a treasury perspective, we don't necessarily sort of like support the issue around ring fencing the revenues legally in the system, but we do support the use of the normal budgetary process to fund programs that are intended to assist with regards to health promotion or any other program that deals with the impacts of alcohol consumption, without necessarily saying all the revenues from alcohol excise goes to a particular department for a particular program, because in that way it causes a lot of problem in terms of your budgeting, because you can imagine if you have a situation where you raise, just like in our case, annually we raise more than 47 billion. Then if the department doesn't have programs that can utilize those funds, and we have legally built a ring fence those funds, then you have that money sitting in an account, but there are no programs to fully utilize that money. Whereas there are other needs in government. So we don't necessarily ring fence legally, but we support if there are programs, they follow the normal budget process, and then they get the funding. And then from the tax perspective, from our tax unit, we will support the funding of those programs. Thanks.
Thank you. There's another question that I find particularly interesting, and it's, well, I think we'll take two more questions, 2 or 3. Would you advise that we change the lingo used in reflecting the principles to make them even easier for the different communities? Would not, someone says, we wouldn't want to mess up the messages, however, using more colloquial language in some instances may make it easier to get through some communities. And I'll actually take that on. I think, that's part of our role at Reset is also to find ways to, we're organizing this webinar to have a conversation with you all about it. But then the next thing we're thinking through is how to equip specifically advocates, as AJ was mentioning, to have the capacity to take this on and then push the policy forward using simple terms, right? So I think cheat sheets, one-pagers that we all agree on that can be shared and make it even more simple are definitely kind of the next step for this work, because I agree it's a real need, and we still get confused with a lot of these terms sometimes in our day-to-day work, so we can't expect everyone to handle these communications if we don't do our part. And then another question, tobacco taxation benefits from clear international guidance, with the WHO recommending that excise taxes make up at least 70% of the retail price. Alcohol still lacks a comparable benchmark. Should the global community develop one, and what would, in your view, be a reasonable target to aim for? I think the last part of that question might be really tricky to answer, but I would love some context on, why we don't have a comparable benchmark.
So I can give a little history there. When the benchmark was developed for tobacco, it was already far more advanced than we have for alcohol. And so we had actually a very clear idea of the countries that were doing well with their tobacco taxes, and they were the ones hitting this 70% excise tax of price or 75% total tax share, in that range. It varied a little bit in the early days. We do not have that luxury for alcohol, so we can't pinpoint that exact, magic number, if you will. But what I can tell you is what I had on the slide very early on, is that tax shares are ridiculously low. We're talking like 20%. So if we hit 70%, I'd be jumping for joy. But that's probably not realistic in the short term. Let's aim for 50 and see where we get. I think that this benchmark can be a moving one. But I think if really countries just should be aiming to make these rates go up significantly. As Empo said, you've got to stay ahead of inflation. You've got to stay ahead of real income growth in a lot of circumstances, because we have some high growth countries where we have a lot of rising alcohol consumption. This is very worrisome. You've got to stay ahead of these things, and you have to stay ahead of it a lot, because we know that the rates are low. And so if we want to push that tax share up, we really need to be more aggressive. But yes, I would love to see 50% tax share in 5 years. And Itziar.
Thanks. Completely agree. We don't have the same evidence at this point as we did for tobacco for establishing a fixed benchmark for alcohol. We are working towards developing indicators, etc., to be able to discern to a better degree best practices and give more clear guidance. An example of that is the tax share indicator, which tobacco had it since 2008, but with alcohol, globally, it recently started getting implemented in 2022. There's still more indicators and resources that I think we need to develop in order to give an evidence-based benchmark. Having said so, I don't think the lack of a benchmark should impede countries from moving forward in implementing this policy that we know is cost effective. We have the evidence, we can back it up in terms of the lack of use and the benefits of making a better use of it. I don't think we need quite a benchmark, although it helps from an advocacy perspective.
Thank you all. I think, as it often happens with these webinars, we have a lot of great questions. We can't get to all of them. If there are burning issues, we encourage you to get in touch. And I just want to see if there are any last words from our participants, our panelists today. Otherwise, I'll go ahead and wind us down for the day.
Yeah, maybe from my side, I mean, based on some of the questions that I've seen in the Q&A, I think it's quite important from a government perspective to really think about how one designs these excise taxes so that they have an impact that you require, both from the health perspective, as Jeff has presented, that one has to think about the alcohol content, but also in terms of how one increases the excise on an annual basis, so that one considers the impacts of inflation and changes in incomes and all of that, so that in the long term, one makes these products less affordable. And I think the issue around that the excise are regressive, will impact the poor, I think the way to think about it is that actually not doing increasing excise, all of that, the impacts of alcohol consumption, they are felt more by the poor. And to also protect the poor, and also that they are responsive to the price, you need to implement those principles that have been recommended. Thank you very much.
Thank you for those were great last words, actually, because I think the final note is really that in order to have an impact, design matters. Intention and design really matter. And I think that's what we wanted to convey with this policy note. Thank you all for walking us through the note and discussing. There were a lot of questions about how these taxes need to be implemented in different resource settings, and I think that's kind of also the conclusion. It will depend, but the word of the day is really good design and intention, and being clear that not all taxes are created equal. Not all alcohol taxes are created equal. So thank you everybody for joining today. It was a really rich discussion. I know I had a really good time, and again, thanks to our guests and panelists for joining us from all over the globe and so many time zones. What a privilege to be here. Thank you.
Thank you.
Thank you.
Thank you.